Hey everyone, I'm John Russell, and thanks for joining for Total Thyroid. This is going to be a pretty short episode, but we're going to talk about 5 things that I wish that every patient knew before they had thyroid or parathyroid surgery. As a thyroid surgeon, so all I do is thyroid and parathyroid surgery all day, every day. I worked at Johns Hopkins. I directed their multidisciplinary thyroid tumor center, and now I've started the Russell Center for Endocrine Health in Columbia, Maryland. So all I talk about is thyroid surgery and options for thyroid surgery. This conversation today is not going to apply to you if you're thinking about doing radiofrequency ablation or another type of ablation. Instead, this is a conversation for patients who are going to have surgery. But anyways, without further ado, this is the 5 things that I wish every patient knew. Number 1, the first and most important question that you should ask when you've been recommended to have thyroid surgery and you meet with your surgeon is, how many thyroid surgeries have they done and how many thyroid surgeries do they do? That's really important. The average surgeon, if you're doing thyroid and parathyroid surgery as safe as you possibly can, needs to be doing at least 100 cases a year. There's lots of evidence that suggests that the more you do, the safer your surgery is going to be as a patient. That's what you can do to make sure that you keep yourself safe. So that's number 1. Number 2, before surgery, if you're having a total thyroidectomy, which is what we would do for a bad cancer or for Graves' disease or for nodules that are big on both sides or for a few other reasons. But if you're having a total thyroidectomy, taking calcium before you have surgery can keep you out of the hospital after surgery. And the reason is that one of the risks of thyroid surgery is that it can affect your calcium levels by affecting your parathyroid glands. And so if your body is fully tanked up on calcium going into surgery, it can help you so that you have a better outcome and a better recovery afterwards. So something simple, you can find Tums. And of course, you should talk about this with your surgeon. You shouldn't just go into this without talking to somebody. But if you find Tums, which is just over-the-counter calcium carbonate, that's actually just full of calcium. And if you take 1 or 2 of those every day, it will kind of, for the week before surgery, it will kind of make sure that you're all the way topped off and that you're ready to go going into surgery. That's if you're having a total thyroidectomy. But again, make sure you talk to your surgeon because we don't want to change any of their plans. And even it can affect some of your other medications as well. So important that you talk to your doctor before you just decide to do that by yourself. Number 3, pain from thyroid surgery is usually going to be a lot less than you expect that it's going to be. Why is that? Well, that's because thyroid surgery pain, there's not a lot of pain receptors. In fact, there's none inside of your thyroid gland itself. And so it mostly has to do with the muscles and structures that are close by your thyroid gland. So those very delicate muscles over the top of your thyroid and then the delicate voice muscles back behind. That's what's going to actually feel pain, and the other structures are going to be less sensitive. And so thyroidectomy pain is usually pretty mild. That actually leads us into number 4. Number 4 has to do with the choice about whether or not you have a scar when you have thyroid surgery. What do I mean when I say that? Well, it's actually a choice for most people. Most people don't have to have a scar if they don't want one. Now, if you want a scar because you think it looks cool or because it would give you the chance to explain to everybody that you had a health condition, that's totally fine. And I get it. And I have had some patients who just, in fact, I had one patient who thought it would look really cool on Instagram. And so if you would like to have a scar, that's how most surgeons do it. But at this point in 2026, your decision about how you have thyroid surgery for most people is just a decision. How do you actually want to do it? Do you want a scar or do you not want a scar? But that does rely on you finding a surgeon who offers scarless surgery. But the reason I associate that with pain is that there is some research that if you have surgery without a thyroid scar, you might have less pain during your recovery. So that's an interesting finding from some of the research that has been done. Okay, so that's number 4. And now let's finish up and let's get back to number 5. Everybody thinks that you're going to gain weight after you have thyroid surgery, and you shouldn't. If you see that you are gaining weight after thyroid surgery, you need to talk to your doctor. It could be that you need to have some T3 added to the T4. What is T3? Well, T3 is the active version of thyroid hormone, and some patients don't convert the inactive version, which is T4, into T3. And if that's you, you might not feel well and you might be sluggish and you might gain weight. And all of those things, there are things that we can do to help. In some rare cases, we might even talk to you about putting you on a GLP-1 afterwards, because that can also help people to lose weight or not to gain weight. People always get worried, what if I have thyroid cancer? Is that going to be a problem? It is with very rare subtypes of thyroid cancer, but not for most patients with most types of thyroid cancer. So again, talk to your doctor. So thanks for listening. Let's just recap. There's 5 things that I wish that every single patient knew about thyroid surgery before they had it. Number 1, find out how many surgeries your thyroid surgeon does, and you want that number to be more than 100 each year. Number 2, take some calcium if you're having a total thyroidectomy and if your doctor is okay with it. Number 3, pain isn't going to be as bad as you expect for most people most of the time. Number 4, you get to choose if you want to scar or you don't want to scar for almost all patients. So talk to your doctor or give us a call. Number 5, finally, remember that you shouldn't be gaining weight after thyroid surgery. We expect you to have just as good, if not better, of a quality of life after you undergo a successful thyroid surgery. So talk to your doctor or give us a call if we can help.